In Washington, a quiet but potentially seismic shift in United States drug policy is under discussion. President Donald Trump is privately weighing whether to reclassify marijuana, officially labeling it less dangerous than current law suggests. Here's what the move would mean, why it's on the table now, and how it could reshape business, science, and patient care.
First, the basics. Federal law places marijuana in Schedule 1, the strictest category reserved for substances with a high potential for abuse and no accepted medical use, alongside heroin and LSD. The proposal would drop marijuana to Schedule 3, home to drugs such as Tylenol with codeine and ketamine, which have recognized medical value and only moderate potential for dependence. This would not legalize cannabis nationwide, but it would mark the government's first formal acknowledgement that the plant has medical benefits.
Why now? Money and taxes. Because cannabis sits in Schedule 1, an IRS rule called Section 280E bars companies from deducting ordinary business expenses like rent and payroll. Effective tax rates can soar past 80%. Moving to Schedule 3 would lift that burden, allowing marijuana firms to be taxed like any other industry. Not surprisingly, the sector is lobbying hard. One cannabis political action committee recently donated $1 million to a Trump-aligned super PAC, and the CEO of Scott's Miracle Grow says Trump has personally pledged to push the change through. The bureaucratic process began in August 2023, when the Department of Health and Human Services recommended rescheduling to the Drug Enforcement Administration, which has final authority. Progress then stalled. A public hearing slated for January 2025 was postponed after legal challenges, leaving the ultimate call to the new DEA leadership. Trump's nominee for administrator, Terry Cole, has previously voiced skepticism about cannabis's health effects, adding another layer of uncertainty. Opposition is already organizing. Several Republican senators have introduced a bill to keep the punishing tax rules in place even if marijuana moves to Schedule 3. And anti-legalization groups are expected to sue, arguing the change endangers public health.
If rescheduling happens, the ripple effects would be immediate. Businesses would see dramatic tax relief, likely unlocking new investment across cultivation, retail, and ancillary services. Scientists, long frustrated by red tape surrounding Schedule 1 substances, would find it far easier to secure approval and funding for cannabis research. Patients wouldn't suddenly find marijuana at every pharmacy, but federal recognition of its medical value could encourage more doctors to recommend it and reduce the risk of federal penalties.
A decision that once seemed politically impossible is now under serious consideration. Whether President Trump ultimately greenlights the move or the effort stalls in court, the debate underscores how economics, medicine, and politics are converging around America's most controversial plant.